All right, welcome back, everybody. An important conversation right now, so settle on up, pour your coffee, because despite the majority of us Canadians having access to health care, not everybody's experience is the same in so many aspects. This can be said specifically with racism in the medical field. To tell us more about it in health care is the head of critical care at the Ottawa Hospital. We welcome Dr. Kwadwo Kyeremanteng. Good morning.
Thanks for having me, Dina.
Thank you for being here. It's funny because we were chatting during the break. Not funny, but it's telling of what a kind person and empathetic person you are, because you said, as busy as you are and under as much strain as the healthcare system is, as we saw yesterday, there's a summit as to what to do to help alleviate the burdens across this country. You said you wish you could lend even more of your platform and time to talking about today's issue. And I said, are you kidding? You flew from Ottawa to talk about it today. And if we help even 2 or 3 people change the way they behave, and they may not be aware, that's incredible. So let's get into it. What is this sort of medical racism we're seeing within the healthcare system?
Yeah, it's unfortunately quite rampant in Canada and in healthcare, where the way we respond to our citizens affects our overall health outcomes. So we see that in Indigenous populations, we see it in Black communities. And so, you know, when they're prejudged based on their appearance, they're sometimes thought to be, for example, abusing substances or drug seeking. That affects outcomes. Like, we've seen it several times within, for example, in the Black community. If you're coming in with a pain crisis, you're less likely to receive pain medication. If we look down south, if you're a new mom, you're more likely to have a negative outcome. Your baby or yourself are a lot more likely to have a negative outcome just based on the color of your skin. And even within our own country, if we look up in our Indigenous populations, access to care is not always available. So we, unfortunately, have a lot of work to do.
And you say the pandemic has only made it worse. So how so?
Yeah, this is where I felt, as we were talking earlier, felt like a need to be more vocal about some of these issues. We really put a lens on where our gaps were. And the pandemic showed, for those that were essential workers, frontline staff, this is where these populations were hit the hardest. You know, when it came to acquiring COVID, being from the most color communities. And so this is why I think it's important to highlight these areas and why we need to have these conversations.
You're in the hospital day in, day out. Do you have any personal stories you'd be willing to share, or secondhand stories you'd be willing to share?
Yeah, it's funny because you think healthcare would be immune to these scenarios, but even in medical school, I've been, unfortunately, hear comments like, if you're from African descent, you might be inferior. I've been in a room where they're asking when the real doctor's going to enter the room. I've been called the N-word. I've been called all sorts of names. Even as recently as a few months ago, as chief of the department, I was introduced in that fashion, and the patient said, you know, chief of what African tribe, like almost alluding to, like, how could you be a chief of department? And so, yeah, unfortunately, this is something that I've experienced throughout my career, but I do think there's reasons for optimism. I do think there's reasons for hope, and I think the fact that we're on a platform such as this to put a lens on some of these issues will make a difference.
So what do you want to say to people to be part of the solution instead of adding to the problem?
You know, Dina, I think it really comes down to all of us collectively having more of a lens of compassion and empathy and understanding. Like, every one of us that is a person of color has gone through stories that you would never want to hear. And I think if we come at it with that lens, you know, when we hear somebody say Black Lives Matter, not to say all lives matter, like, to come from a lens of compassion, that's a start. I think embracing diversity within medicine, you know, this is only going to improve patient care, patient outcomes, and this is the reason we all get into healthcare, is to help others. And the last thing I'll say is, those people of color that want to be part of the solution, I think it's important to tell your story and personalize and make it relatable, but also get a seat at the table. You know, aim high, try and get into medicine, try and be that nurse, try and be ahead of a department, because by having by getting a seat at the table, you could advocate for your people.
Thank you for inspiring and for sharing and for being so honest. I know when the room's this quiet, it's landing everywhere, and let's hope that that continues for our viewers and across the country. Be good to one another, and thank you so much.
Thanks so much, Dina.
Well,